I'm Raul Gonzalez. I'm a licensed insurance agent and owner of Texas Medicare Solutions. Today, what we're going to do is we're going to do a basics of Medicare instructional video just to let you know a little bit more about how Medicare works. It's kind of the first steps that you want to take when you first get Medicare. So let's get started. Again, this is the basics of Medicare, and I do want to let you guys know that Texas Medicare Solutions is not connected with or endorsed by the United States government or the federal Medicare program. This video is for educational purposes only. No plan-specific benefits or details will be shared. So let's go ahead and get started. When do you sign up for Medicare? That's the first question that people ask us. So here's what I'll say. Medicare is for three basic groups of people. The first, people ages 65 and older. Number two, people under age 65 with certain disabilities. And three, people of all ages with end-stage renal disease. For today, we're going to assume that you're in the first group. Most people enroll around their 65th birthday. You can enroll during the 3 months before your birth month, the month of your birth, and 3 months after the month giving you a 7-month initial enrollment period. Depending on when you enroll, coverage can start as early as the month of your birthday. If you miss your initial enrollment period, you can sign up every year between January 1st and March 31st. If you enroll at that time, your coverage is effective July 1st of that year. Under certain special circumstances, you may be eligible for a special enrollment period. If you have questions about that, leave a comment here or give us a call. If you're still working and covered under employee group insurance, you can either enroll in Medicare and drop your group coverage, or you may be able to delay enrollment and stay with your employee program. You need to compare your plan at work side by side with your Medicare coverage and decide which is better for you. Before deciding to leave your employer plan, always discuss all of your options with your Medicare, with your benefits administrator, insurer, or plan provider. In most cases, once you leave, you can't return to an employer plan. How do you sign up for Medicare? Well, if you're collecting Social Security, enrollment in Medicare is automatic and you'll receive a card in the mail 3 to 4 months before your birthday. Call your Social Security contact if you have any questions about that. Now, if you're not collecting Social Security, the quick answer is you can enroll two different ways. You can either call Social Security to schedule an appointment at 1-800-772-1213, or you can sign up at medicare.gov. But we've recently created a video right here on YouTube where you can go ahead and it's step-by-step instructions by one of our agents, Jim Belcher, on how to apply for Original Medicare. So go ahead and follow that link after you watch this video and take a look. Now, Original Medicare. The Original Medicare program was signed into law on July the 30th of 1965. Today, over 56 million Americans are enrolled in the Medicare program. That's most Americans age 65 and older, regardless of their income or health status. You're going to hear a lot about Medicare Supplement policies A through N. Original Medicare has only two parts, A and B. Part A is for hospital care and Part B is for medical services. So let's start there. Medicare Part A is usually free to you. I should say there's no cost because you've already paid for Part A all the years that you've been paying taxes. And so you don't have to pay anything, but you do have to enroll. Once you do that, you can rely on the basic coverage or purchase supplemental coverage for additional protection. So what does Part A cover? It covers things like your hospital room, meals, general nursing and hospital services and supplies. It does not cover private duty nursing, comfort, or convenience items. Coverage is for up to 90 days per benefit period, and the first 60 days are covered at 100% after the Medicare Part A deductible is met. You pay an out-of-pocket cost for any days after 60. There's additional 60 days of coverage called lifetime reserve days, but it can only be used once. It's important to note that the deductible is $1,408 for 2020. And that applies to any new benefit period. So if you go into the hospital for a couple of days, you get discharged and then return a week later, you're still in the same benefit period and will not be charged again for the $1,408 Part A deductible that you incurred on that first confinement. If you're out of the hospital or skilled nursing for at least 60 days in a row, a return to the hospital would begin a new benefit period and you would owe the Part A deductible. Most people do not pay a premium for Part A. Now, let's talk a little bit about Part B. Medicare Part B is optional. It covers things like doctor's visits, lab works, and x-rays outside a hospital stay. It's an 80-20 plan, meaning that Medicare pays 80% of the approved expenses and you're responsible for the remaining 20%. The premium for Part B starts at $144.60 a month. It can be higher depending on your income. And there's a $198 deductible, but the deductible is for the whole calendar year, not per occurrence. If you collect a Social Security check, your premiums will most likely be deducted. One other thing that I'd like to say about Medicare Part B, and the reason that a lot of times people want to purchase another option is that 80-20 plan. It sounds pretty reasonable, right? To only have to pay 20% of your medical bills. But imagine a situation where a person had chemotherapy and so they're having to pay 20% of chemotherapy, or they have open heart surgery. Because I want to stress to you that Part A gets you in the hospital, but while you're in the hospital, any doctor bills that you incur are covered under Medicare Part B. So Part A gets you into the room, but Part B is who covers your doctors, your anesthesiologist, the surgeon, even the doctor that comes in and says, "Hey, how you doing? I hope you're feeling well." And then they send you that bill. It covers all of those. So it's a real important thing to remember that, hey, that 20% could add up. If it's $100,000 in bills and you're paying 20% of that, just think about that. It's $20,000. So I want to make sure to stress that part to everybody. Now, let's go ahead and for a minute talk about Part B premium. This chart shows you that if you're a single person with an income of $87,000 or less, or a married couple with an income of $174,000 or less, the premium is $144.60 per month. Now that covers a lot of people. However, depending on your income, the monthly premium can go up to $491.60 a month. Now that would only apply to singles making above $500,000 and married couples with a combined income above $750,000. Now for those of you who want to know if you're above that threshold of $87,000 for individuals and $174,000 for married couples, the income that is used is your modified adjusted gross income. And I will tell you that I am not an accountant, so I can't tell you what that is, but I will suggest that maybe talk to your accountant and ask them what your modified gross income is for 2 years ago to kind of get an idea of how much you're going to be paying. Now, what you don't get with Part A and B. So I'll tell you, you don't get dental coverage, you don't get vision, prescription drugs, hearing, or even help with long-term care. That's important for you to know that those things aren't covered. But we'll get back to that. We mentioned that prescription drugs aren't covered. Now that's original Medicare Part A and B, but Medicare does have an option for your prescription drugs now. So we'll talk more about that. So when you delay Part B, well, if you or your spouse are working, you may be able to delay enrollment in Medicare Part B depending on the size of your employer. So what I'll say is that number is 20 employees. So if you're covered under an employer group health plan or your spouse is covered under an employer group health plan, there's no penalties and no loss of options. But if there's less than 20 employees, then I want you to know that you could be responsible for that late enrollment penalty. That's something that you'll want to talk to Medicare about, just so that way you can make sure to get the right answer. So I want to stop right there for just a second. That's something that I feel is super important, is that what we see a lot of times is people who get the wrong information. So I want you to pause there. If you work for a small business and you're not sure, double check. Make sure, because this is a decision that could affect you for the rest of your life. You see, if you end up getting a late enrollment penalty, that late enrollment penalty will be something that you're responsible for really forever. So we just want you to look after that. So, do you enroll in Part A and B, Medicare Advantage, or even a Medicare Supplement plan? Or do you continue with employer group health coverage or possibly even union coverage? That's a very hard question, and unfortunately, I can't answer that without knowing your specific needs. If you do want to discuss that and you live in Texas, feel free to contact our office at 210-908-6565, and I or someone on my staff can help you decide. If you don't live in Texas, I would Google independent licensed Medicare agent and then type in your city and see if maybe you can get some help from someone who is very familiar with these types of plans. So, retiree or union plan. So first, if you have the option of continuing on an employer group health plan, a union plan, or a retiree plan, you want to compare it to Medicare A and B. Medicare suggests that you talk with your employee health benefits administrator and ask these questions. Just remember that retiree coverage for health care after you retire does not count as creditable coverage for delaying enrollment in Medicare Part B, and neither does COBRA. So the questions you want to ask are there co-pays and deductibles on my current plan? Does it include a drug plan? If I opt out, can I opt back in later? What's the cost? And does it include dental and vision coverage? And you can compare those to original Medicare. So, if you want to explore Medicare supplemental insurance or Medigap, there are a lot of options. And you must have Medicare Part A and B, but then purchase a Medicare supplement policy to cover certain costs that Medicare does not. There are 10 federally standardized Medicare supplemental insurance plans that are offered in most states, plans A through N, and they're offered by many different insurance companies. Here's what's important. All Medicare supplement plans contain the same basic benefits, and all plans with the same letter provide identical coverage for medical expenses no matter where you buy them. Plans have the same standardized benefits for each letter category. Only the premiums may vary. Your policy may have a different cost depending on insurance company, but still have the same coverage. Although there may be a policy with an additional innovative benefit in your area, look at proposed plans alongside each other and compare those to what you already have with Medicare A and B, then decide. Most people that we talk to choose either Plan G or N. So when is it the best path? Well, when you want a budget medical cost. You can say, hey, look, this is how much I'm going to be paying for my costs. Or say if you travel and you may need to see a doctor away from home. Maybe you live half the year in a cold climate and half the year in a warm climate. So again, it could be the best path. If you want to see any doctor or specialist with no referrals and really no hassle, when plans help pay some of the healthcare costs that Medicare does not pay, so deductibles, co-insurance, and co-payments, and it could be the best path if you can keep it as long as you pay premiums on time. So the best part about these is that they're guaranteed renewable. So when you're 75 or 80 years old and maybe your healthcare costs do go up, you know that as long as you've continued to pay your premiums, that the plan will still be there. So Medicare Advantage. Medicare Advantage plans require that you have original Medicare Part A and B, and it provides coverage through provider networks, also called HMOs, PPOs, and MSAs. Medicare Advantage Part C covers everything that original Medicare covers, as far as they have to cover all things that Medicare offers, and can include coverage for Medicare Part D. The key benefits is that Medicare Advantage plans include a maximum out-of-pocket feature to help you control costs. What I'm saying is, remember how we talked earlier about chemotherapy. If a person were on original Medicare and they had to get chemotherapy, they'd be responsible for 20%, and there's no end to that. Under a Medicare Advantage plan, maybe they still have 20%, but they do have a maximum out of pocket, meaning that's the most that they could get billed for in a year. So it's just really protection for from going bankrupt for your medical costs. And that's something that's really good on those Medicare Advantage plans. So when is the Medicare Advantage the best path? Well, if you want to pay a lower premium, usually Medicare Advantage plans have a lower premium. Let's say that you also have a VA, and so you would use a Medicare Advantage maybe just as a backup for when you're not inside the VA. Maybe you like the network of doctors. That's always a good reason to be on a Medicare Advantage plan. You'll find that there's a lot of good groups out there that work with Medicare Advantage plans. So the other time is if, say, you're on a low income subsidy from Medicare, maybe the cost of a Medicare supplement just financially doesn't make as much sense, or you're unable to afford it, then a Medicare Advantage plan could be a really, really good option. So as far as prescription drugs go, Part D covers prescription drugs. Think D for drugs. Now the costs vary by county depending on the plan. Part D may or may not be part of the employee group health plan, a union plan, or retiree coverage. So veterans are not required to enroll in coverage, but may choose to do so. So if you have VA coverage, you maybe don't need it, but it is something that you could do if it makes sense for you. So as far as extra help goes for prescription drugs, here's what I'll say about this. If you think that you might qualify, you definitely want to put in an application and just see. So you can apply for a low income subsidy, and we'll have another video on how to do that very soon. But here's what I'll say is if your income is less than $18,735 for singles, $25,365 for couples, and you have resources less than $14,390 for singles and $28,720 for couples, that you could possibly get approved for that. And it's going to help with the deductibles, with your co-pays, and even your premiums. Now, these amounts are for 2019, so again, they change. But if you think you might be right around that amount, I definitely recommend going in and to Social Security and applying for extra help for your prescription drugs. Now, as far as the Medicare coverage gap goes, I'll just explain that the way that your coverage works is you're going to have coverage with co-pays, and you'll read through it when you sign up for a plan, but it'll have co-pays, and those co-pays will go until you spend $4,020 on total cost of medications. Again, that's $4,020 on the total cost of your medication. So if your medication's $100 and you have a $20 copay, the full $100 gets deducted from that $4,020. So if you spend $4,020 in a year, you go into what they call the coverage gap, and at that point, you're going to pay 25% of the cost of generic drugs and 25% of the cost of brand name drugs until you spend a total of $6,350 out of your own pocket. Now, that's the full cost of the medication. When you spend $6,350 out of your own pocket, that is when catastrophic coverage kicks in and you'll have more coverage again. So just a little bit of information on that. So this is a lot of information to take in, and you'll want to take some time reviewing all your different options. If you have any questions, don't hesitate to put a comment here with your questions. Let us know what you're thinking. Let us know if you have any questions. Don't hesitate to get in contact with us. We'd love to talk more with you. If you have any questions, don't hesitate to reach out or give us a call. There's people out there who are low income that might qualify for Medicaid, and that's an important thing to know. So if you qualify for Medicaid, there are special plans available, the Medicare Advantage plans, or you could just be on original Medicare and Medicaid and just get a little bit of extra coverage, a little bit of extra care, where maybe you're not responsible for as many out-of-pocket costs. So again, there's just so many different things out there. This is just the beginning of your Medicare education. But feel free to follow our page if you have any other questions, and hopefully we can answer them in videos, or don't hesitate to reach out in comments or give us a call, 210-908-6565. Thanks so much.